Welcome to Skillcast, the podcast by the London Organisation of Skills Development, where skills are the forefront of all conversations. My name is Nurbanu, and I'll be the host for Season 1. Join me as I dig deep and be a little nosy and find out the story behind the skills our expert guests share with us. Today, I'm joined here with Dr. Rishi Sharma. Dr. Rishi Sharma, please go ahead and introduce yourself to everyone.
Hey Nurbanu, first of all, I want to present my thanks to you for organizing this podcast. And I'm highly feeling on the 10th level or 7th heaven, sitting in the halls of Oxford University, the leading universities in the world. And today I am talking about cancer immunological sciences. So my name is Dr. Rishi Sharma. I'm the head of the Department for Cancer Immunological Sciences, and I'm the director of Candrol Center of Oncology. I practice immunotherapy in Jaipur, Rajasthan.
What is immunotherapy? I've never heard of that term before. I don't know, am I really backward or something? I don't really know what it is. So could you please tell me more? What is immunotherapy?
Well, immunotherapy is not a newer system of medicine. It is a branch of medical oncology which treats advanced stages of the cancer, either independently or in combination with other conventional treatments like that of chemotherapy or radiation or surgeries.
Interesting. So does it have any side effects?
Well, the side effect profile of immunotherapy is comparatively lower. Generally, we see in some of the patients, they might develop slight elevation in the sugar levels, or they may feel slight sleepiness. But these are very manageable symptoms and they do not count under the major side effect profile.
Is this the same for all patients or does it differ person to person?
Well, Nurbanu, no, it doesn't happen like that. If it would be same for every patient, then there would be no difference between chemotherapy and immunotherapy. Immunotherapy is going to be highly individualistic and customized solution for majority of the patients. It is prepared very individualistically. It is prepared while studying reports and findings of the patient. In the lab, the preparation is going to be done and then it is going to be administered either orally or IV.
Are there any particular challenges that you face day to day when dealing with such patients?
Oh yes, the challenges do come on daily basis. Most of the time people, since the practicing physicians of immunotherapies are comparatively lesser in the country like that of India, so they move towards chemotherapy or radiation. And once they see that these therapies are not getting immense benefits for them, then they seek other opinions and the newer treatments like that of immunotherapy. So these are the challenges. I always tell to the people that once the diagnosis has happened, and if they can start with immunotherapy in combination with chemotherapy and radiation, the results are going to be outstanding for sure.
Would you say it's like a holistic sort of treatment?
Yes, Nurbanu, it is a holistic approach of treatment because the patient as a whole is covered in that. And sometimes we see very miraculous results when we assess patient during the treatments. We see that there is no mitotic activity still prevailing in the body and patient is very easy, even if the disease is going to be non-curable for them.
Yeah, I think it's really interesting that it's quite an open-minded sort of therapy because you're able to combine it with other conventional therapies. Whereas if you went down the route of radiation in chemotherapy, with those treatments, you can't combine it, but with immunotherapy, you can. I just find that just really interesting. It's like it's open, in other words.
Oh yes. And if we talk about the recent and the latest guidelines of MD Anderson's and the leading universities like Oxford's and Cambridge, even they follows this guideline that if the case is non-curable or if you cannot bring about cure in the patient, better combine modalities together to get add-on benefits and summative effects in the body. So if we want to give a very good palliation to the patient, this certainly is the best way we can offer to the people.
Is this just treatment just specific to your clinic in India, or can other people?
No. Immunotherapies are now being used in majority of the countries across the globe. It is widely used now in India as well, and through telemedicine, we are able to reach patients of approximately 26 countries across the globe. So the doctor is just right away a click only.
Is it as effective when applying it through telemedicine?
Since we do not take indoors, so it can be done telemedicine way, and patients can be treated remotely even, because AI and the latest tools and technologies, they have taught even the doctors to communicate with the patients who are sitting wide apart in the various countries across the world.
Oh, wow. So how many years have you been practicing this way?
Well, Nurbanu, I'm into my 16th year of practice.
Oh, wow. Dr. Rishi, that's a very long time.
Yes.
How has the field changed in the last 17 years? Is it been the same, or have there been different shifts?
So when we started, I can still go back into my days of college where PET scans, especially, they were new that time, you know. So the evaluation of patient used to be done. They were done by conducting MRIs or CTs. But now, since we have very high latest innovations in imaging techniques as well, like that of PET scans, so they have made clinical evaluations rather more easy and very accurate. Yes, I can see that.
I think the certainty in your voice, it really just comes across like, it sounds like something you're so passionate about.
Oh, yes.
Where did the passion come from? Do you have any family history or something with a cancer background that got you so inspired? Because the way that you talk about it, it's just like, it's just so much love in your tone of voice that comes
Nurbanu,
across.
Since my father is also a doctor and I come from a doctor's family, we are 7 doctors in my family currently who are practicing into different specialties. My father taught me one thing, that as we are progressing, as we are moving ahead in the practice of medicine, we are losing compassion. We are losing, because this is something which a doctor should adore in himself. If a doctor doesn't know how to communicate, if a doctor doesn't know how to touch a patient and give a healing effect to the patient just by touching onto him, it is something which adds a extra jewel in the doctor's hat. You know, it is something which this quality should be there in the doctor. So yeah, you can say that it runs into my family and it runs into my genes. Practice of medicine is something which I always loved, and the opportunities which I got in the life, coming on to Oxford University and speaking in front of the world itself, is a big opportunity and big thing for me, for sure.
I love it. It sounds so beautiful, the way that it comes across. Oh, it's so nice. So you said 7 people in your family are all doctors. Are they all in different specialisms?
Yes, they are into different specialties: general medicine, pediatrics, gynecology, obstetrics, dentistry. There are different specialties under one roof.
Who inspired you to choose this particular oncology?
This was when I was into third year medical school. I decided to go into a core branch. I always wanted to do something which is something unique and which can give extreme benefits to the patient, even if cancer is non-curable.
I wish that all doctors were like you, who are just so kind, so compassionate, really have that care for people. It's very rare to see that these days.
It's very rare. Most of the young doctors are, but I want to say here, most of the young doctors who are coming out from medical colleges, they have that fire in the belly to serve to the people, to serve to the humanity. And trust me, the fire in the belly will be only among those medical students who come from a deprived family background. A rich family guy or a rich family son or daughter, I don't think they will be that much hungry to serve to the community, because they have got everything in them. They did not see the poverty. They did not see how to give back to the society, because they have everything. Certainly, the deprived family background kids will be one of the finest surgeons of the world and practicing medicine specialists. I hope this quality of compassion and humanitarian nature gets restored very soon.
No, I completely agree, and that's you say that so beautifully. I don't have any words to even say anymore. Thank you so much for joining me today on the Skillcast podcast, and I really hope that people who are interested in immunotherapy would reach out to Dr. Rishi Sharma, who is so compassionate, so kind, one of a kind doctor from Jaipur. He offers telemedicine. I will list all of his details in the description of this video. Thank you for listening again. Have a good day.
Thank you, Nirbana. It was a pleasure talking here in the halls of the Oxfords, and I really loved talking to you. Thank you so much.